Real women.
Real talk.
Real messy.
This is Messy Midlife. Hi, everybody, and welcome back to Messy Midlife. It's me and Karen again. Hi, Karen.
And
How are you doing?
Good. Dealing with some congestion, so I might sound a little bit funny, but excited to talk about our topic again today.
Yes. And I am grateful that you're willing to come back and have the chat just because I still have so many questions from the last time that we talked about this stuff. So just to anybody who happens to just have started listening right now, we're talking about being a highly sensitive person in perimenopause. And one of the things that really I finally clicked and it's stuck with me since our last conversation is that someone who is a highly sensitive person, you shared, is just their nerves are just firing more frequently, that they're more easily firing. And so there's greater awareness and processing of sensory stimuli and the environment. And it's not just, it could be internal environment and it could be external environment. And so the light bulb that went off of, oh, that's why you always say people need more electrolytes, because electrolytes are part of that signaling biochemistry that's happening. And since then, I've been thinking about all of these questions that I've got about, okay, so there's got to be so many things in perimenopause that a highly sensitive person experiences a little bit differently. So I'm hoping you're up for putting your doctor hat on even more than our last conversation to chat a little bit about this so that my brain can have that like loop closed, and anybody who doesn't have access to you to just text and say, hey, what's going on here might get a little bit of insight today. Is that good with you?
Sounds good. Yeah.
All
Yeah,
right.
let's get to it. I think that's a good starting point, actually, circling back to the most fundamental central definition of sensitive person, which is that we experience things more intensely and that our nervous systems will perceive and process the world more deeply. And that means more chemical reactions and more nerve conductances. And that's particularly relevant during perimenopause and any period of our lives where there's a transition happening physiologically and even environmentally. But we'll stick with physiology this time because there's enough to talk about there.
Yeah.
The changes that happen in our hormones, and we talked briefly about it at the last episode. Primarily, we start off with a shift in testosterone and then progesterone and eventually estrogen. These changes impact our nervous system. I mean, they impact every organ system in the body, and the nervous system is not an exception. And so for sensitive people who already have a very perceptive nervous system that is processing things intensely and deeply is now being affected by these changes. The hormone picture that we have during our fertile years is really meant to create and protect community. It's very much about, whether people choose to have children or not. Physiologically, that's what it's pushing. And so it's very outwardly focused. And when that shift begins to happen, um, one can feel really raw and we can have even stronger responses to our stimuli. I've seen some posts about how there are these men that are saying like how to survive perimenopause with your partner. And they're talking about how, just don't chew. Just don't breathe, don't
Also,
chew.
but also don't slurp. So it's not like you can just grind up your food and or like eat soup. So like don't chew, don't slurp, don't breathe too loud.
Just excuse yourself to another home, potentially, I don't know, the backyard. So these are things that non-HSP women are reporting during perimenopause. And so we can expect that those types of things are going to be even more significant for us because I'm always the one who hears and smells things that people around me don't necessarily hear and smell even before, right? So in my 20s, I was always that person, and it has continued to intensify for sure. So that's one example of something that can happen during perimenopause that can feel particularly aggravating or more depleting because again, it takes more resources to create a louder sensory experience.
Yeah. So I was hoping we could maybe go through a list of not necessarily all encompassing symptoms, but a lot of the symptoms that people start to experience when they are heading into perimenopause. And that can be a little bit confusing just because, as a reminder, perimenopause can last a decade and it can start well before there are substantial changes to your period, too. And so I'm just curious if you're able to share maybe like a here's the way a person not in perimenopause, but who is an HSP might have differences in this type of symptom anyway. And when you add in perimenopause, what that might look like, and if there are any considerations that somebody might need to look at related to that. And if that feels like too overwhelming for you and too structured for our just general conversation that we would be having in a coffee shop, then just tell me to F off and completely.
And it's not too fly by the seat of your pants conversation, it might not feel like us. So
Right, right.
it's fine. One thing that came to mind actually is almost maybe even flipping that, thinking about some of the nutrient deficiencies that are really common for highly sensitive people and how that ties into some of the amplification of
Mhm,
symptoms that can happen during
mhm.
perimenopause. So similar to what you were just saying, like things that we
Yeah.
experience even before we hit perimenopause and how that relates to perimenopause even being amplified. One of the first things that came to mind as you highlighted already is electrolytes and specifically magnesium. During medical school, my nerd obsession was vitamin C. It was like my absolute favorite nutrient. And then it got dethroned by magnesium because it's just so top to bottom involved in every single physiological function. And it's particularly important for sensitive people because when it becomes depleted, just the absence, not having enough magnesium creates more muscle tension. And that feedback can create a sense of a threat. Basically. So if we have, it's biofeedback. We normally think of our brain creating the experience of anxiety or fear, but it can come backwards. It can happen from our tension in our muscles that is not being driven by an environmental cause or by our own
Mhm,
perception of reality. And because magnesium is involved in detoxification, detoxification is cleaning out the kitchen once you had some sort of an experience and that sensory experience. And that is where magnesium comes into play. So because we're doing more cleaning, we need more water. We need more electrolytes. We need more magnesium. And unless somebody has taught you how to do that, you're not replenishing magnesium. And this plays a role in anxiety even before perimenopause. It creates tension and a sense that there is a threat, even when there's not, other than the fact that you're deficient in the nutrient, which is, of course, relevant and important. Then fast forward into perimenopause, we have anxiety is a really common symptom for women during perimenopause. And if this was not treated and the individual is not replenishing magnesium, there's more fluctuations in hormones, which is requiring more detoxification and higher concentrations of these nutrients. So, if the baseline of anxiety was elevated for a highly sensitive person going into perimenopause, it's possible that highly sensitive people may be more susceptible to higher amounts of anxiety during perimenopause if they don't tend to these things. So, I don't want to be like doom and gloom here. I think it's really important to take the fundamental message, which is this is something that can be managed really well and easily in sensitive people. That's why I love working with this population is because it doesn't take very much. If you go too
mhm.
far, it doesn't feel great. But that
Yeah.
also means that small changes can have a really positive and effective impact.
All right. So this actually leads to a pretty big question for me that I was like, it sort of comes around to all of the stuff that these little notes that I was like writing down. I was like, what about this? What about this? What about this? So sorry, I'm going to just hammer you with stuff today. It's just whatever.
To your
Uh, all right. So if it's one of those things that small changes can be really impactful because of the sensitivity, is it something that is really easy to go overboard and to potentially have the reverse issue? And I bring this up because I was like, okay, I have to ask you about sodium because there's, those high sodium electrolyte packets now too that are mostly salt and that are fairly popular. And that sodium is also a really important component for your cortisol production and for your adrenal function. And so I was thinking, how easy is it to go overboard with that and have the negative impacts of having too much sodium in your body when you're a highly sensitive person? And I've got other questions related to this, but I'm going to pause there and let you give me your thoughts on that
Yeah,
first.
I think it's a really good point. And sodium, I find that most sensitive people actually don't consume enough sodium because we have a high adrenal demand. Adrenals being the glands that help us manage stress. And we talked about this last time. And so we have a lot of adrenal output, and oftentimes sensitive people actually don't consume enough sodium. So for the sensitive person, and consuming too much, of course, would be problematic for anyone, but definitely sensitive people. But that's actually one that does not tend to come up as much. And if it does, it's we don't have a large margin of error as sensitive people. It's like an immediate, oh, that's too much. So the trick really is being very specific about what it is that I'm introducing and taking notes on those things. That's my favorite trick, is just documenting everything that you're doing so that you have a sense of what might be shifting. The first thing that came to my mind about overboard with magnesium, you get loose stools. So
Hmm.
unpleasant, but that's one where it's pretty easy to rectify pretty quickly and notice what it is that's happening. But the thing that came to mind is ADHD medication,
Hmm.
because that can be really difficult to identify as problematic because it might be helping some aspect of your life, but then it can be depleting these other nutrients, which we touched on a little bit last time.
Yeah. That was a big one that I was like, all right, we have to talk about the ADHD medication, especially because there's an explosion of women who are getting appropriately diagnosed with ADHD in perimenopause because we just reached that threshold, like we talked about last week, where the coping strategies that we can rely on are no longer accessible to us for various different reasons, primarily because of the chaos that's happening in our hormones that we we have this internal stuff that we are responding to that makes it harder to navigate all of the other things that you've already coped your way through with ADHD. But there's more than just those medications that can have an impact. So if you're I would love to save that to like connect it together so that if anybody who is listening to this to not just hear us chat about whatever's going on in our lives, so it's like give me some advice, like what do I need to know? Where are my notes for this? If that's okay. I want to ask you a couple more things and then dive into those, if that's okay.
Yeah, yeah, yeah.
Okay. So it's funny that you brought up the magnesium and loose stool because I have a note here. It says vitamin C and magnesium and constipation. And I bring this up because I'm curious that so vitamin C is another one that can cause if you take too much can cause loose stool. And that some doctors will even say if you're using vitamin C when you are ill, that you need to use it until like get it high enough dose that it causes loose stool and then back down just a little bit. And that's the dose that your body really needs when you are in a higher demand state. And so a couple of things that came up, I was like, oh, does this mean that there's a very delicate line for people who are highly sensitive and that need more magnesium and potentially vitamin C, because vitamin C is also vital for cortisol production and adrenal support. And so since you shared last week and just in our conversation today that the adrenals are more tapped out when you're a highly sensitive person because they're constantly producing more cortisol, so you need more of the nutrients that go into producing and the hormones and the neurotransmitters that are produced by the adrenal glands, that you need more of those nutrients and they get depleted more rapidly, but there's that fine line that you can cross over. So I'm guessing both of those are ones that you also have like a higher need, but it's a fine balance. And when you tip over, it goes pretty quickly, but then you just back down with them. The other thing that came to mind was, are people who are highly sensitive more likely to be constipated? And what does that look like in perimenopause too, where your bowels start to change function as a pretty common symptom?
Mhm, mhm. Yeah, and yes, there is that is a prevalent symptom in highly sensitive people. And then the question is it because there's a deficiency of magnesium? Is it
Hmm.
because is it a nutrient deficiency that's driving that? Is it a microbiome issue? There's so many possible options, and it's probably a combination of all of them.
Yeah.
And it does seem to be this really fine line between, bowel movements are not as regular and easy as we want them to be. And so we have these interventions, and now all of a sudden we're flipped over to the other extreme. The flip flopping with bowel regularity is really common, really, really common symptom.
Okay. So the people with IBS could potentially, where they have like the alternating constipation and diarrhea, is that
Yeah.
potentially maybe a, hey, you might be a highly sensitive person if you're having this and it's not in the presence of something like inflammatory bowel disease like Crohn's or
Yes.
ulcerative colitis or
Yes.
something.
Right. Yes. Yeah. And
Is it
even
one of
then,
those things, sorry, I was gonna say, is it one of those things that like we might someday come back and say IBS was never a thing, those were just highly sensitive people?
right, right, and needing to tend to nutrient deficiencies or nervous
Mhm.
system regulation or whatever, who knows? It's definitely a very, very common topic in
Yeah.
my practice. I don't know that because I work with this population so closely, I don't know that I see it more in perimenopause. It's making me want to look at it more closely because
Mhm.
it's such a common issue.
Mhm.
When I start to work with people in perimenopause, I don't know that I've ever heard somebody say this wasn't an issue and now it is. It's usually it always has been. Yeah.
And you brought up a good point with like the nervous system regulation and how people don't always think about the fact that your bowels are so connected to your nervous system because it is your parasympathetic nervous system that's driving the digestive function. And so if you are in a more parasympathetic state more frequently, which from my understanding, people who are highly sensitive tend to be in a more sympathetic state, so more of the alert state, not in the parasympathetic rest and digest state. So it could just also be because of the nature of being more alert that constipation is
What?
present, not necessarily a nutrient deficiency. So
Mhm.
the two could be intertwined. And then, of course, the impacts that that has on the microbiome too, that is just so sensitive to everything we do. Like every time we eat, we change our microbiome. Every time we sleep differently than normal, we change our microbiome. It's just, it's so
Yeah.
delicate.
Yeah,
Okay.
and how the sympathetic state, we we talk about it being a fight, flight, or freeze. So flight and freeze being diarrhea and constipation, right? Not the typically the more parasympathetic experience, which
Mhm.
is a more regulated transit time
Yeah.
that feels more comfortable.
Yeah.
So yeah, it can just be nervous system. So many options.
And this like ties into one of the things that I wanted to clarify from you what you meant because you talked about detox and then you went into hormones and I just want to clarify what that I'm understanding what I think you meant and that was that it just the general anything we produce that is not necessarily toxic to our body, we still need to have a way to clear it as we are going to continue to produce more. Is that what you meant with the detoxification and magnesium and HSPs? Or did you mean toxicants, toxic products that are coming into the body that or did you mean both?
No, internal.
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 Okay.
Yeah.
I think that's just a really important clarification, both for me and for anybody who's listening, because detoxification has become so associated with chemicals and mold and heavy metals and that kind of thing, and a detoxification in our body does not always mean that. And I like it's a sensitive topic for me because I feel like too many people are saying that we're toxic and there's a whole lot of people who are selling people stuff to believe that you're toxic and that you need to be cleaned inside and like just I don't know, all these things that I think themselves are toxic practices that are just making some people sicker than they are helping. And so I just want to make sure that we are clear that that's not what you're
No.
talking about.
Yeah,
Okay.
and I'm really glad you mentioned that because it's an opportunity to highlight what it is exactly that's happening with our hormones and the detoxification, the natural internal process of eliminating waste. So when we have, let's say, an estrogen molecule that has done its job and stimulated the appropriate receptors in the appropriate amount, it gets flagged as ready to be removed from the body. It's no longer in its optimal configuration to do that job. And so it gets flagged, and then it makes its way to the liver, where it needs to be converted into a water soluble molecule to be removed from the body. And that takes a lot of energy. And that's a detoxification process that is natural for any form of waste that our body creates. It gets dumped into the intestines. And this is really important as it relates back to constipation or diarrhea. When that molecule sits in the colon or in the intestines for too long because of constipation, or it's not bound appropriately to something to help get it out of the body, it will get reabsorbed. And then that molecule that was once labeled as trash is now floating around, overstimulating receptors in any tissue that has estrogen receptors. So that can be the uterus, it can be the breast tissue, the ovaries, etc. And then that's when things can become really symptomatic. And fast forward to perimenopause, if that's ever been an issue, it's going to be amplified significantly. So bowel regularity can really impact how your hormones function at any point in life, but especially during times of more change and
And how
fluctuations.
sensitive. It sounds like also how sensitive you can feel to your hormones.
Right. Right. Yes, that's an important topic for the
Yeah.
sensitive person for sure.
Yeah. So let's go through just a couple more symptoms that are associated with this, and just, if you don't mind, share with me and with anybody who's listening about anything that comes up to for like the things to consider before perimenopause, during perimenopause, how these things are affected and whatnot. So we all have the mental health symptoms, right? We've got anxiety, depression, rage, and focus. And focus is kind of a mental health symptom, but I lump it all together because it can show up with so many other things that it can be confused sometimes as other things. So I'm guessing people who are highly sensitive are more likely to experience any of these symptoms, and so more likely again to be amplified in perimenopause.
Yeah.
Yeah.
Yeah. The intensity can definitely rise during perimenopause. And we were speaking briefly just before we started recording about, specifically, I know this is not mental health, but I'm going to tie it back, hot flashes. And I was thinking, gosh, I really don't see a ton of that. And you
Mhm.
mentioned, oh, maybe it's the self-care of the sensitive person, when we have identified as such prior to perimenopause. And so I think that because we tend to notice shifts outside of our optimal functioning range more quickly, and our range is smaller, and when we are outside of it, it seems to be much louder for us. And
Mhm.
so we tend to connect with providers sooner than non-HSPs, because there's the window of tolerance is just different, because the
Mhm.
perception and the experience is different. And so my hope is that sensitive people will have been able to do that prior to reaching perimenopause. But if you're someone who hasn't for whatever reason, then more than likely these symptoms are going to be really, really loud, because anxiety tends to be present for us. It's a sign that we're outside of the optimal range of functioning.
Mhm.
So more specifically, with anxiety and depression and focus. Did you mention anything else? Did I miss anything?
Rage. Rage.
Right. We can't forget that one. There's so much here to talk about. It's rich.
Yeah.
The life experience is rich. I mean, the hope is that there would be a connection with a provider prior to hitting perimenopause. But if you haven't, then yes, it is expected that these symptoms would be much more intense for the highly sensitive person, because there are going to be even more nutrient deficiencies that are fueling this momentum of overstimulation with the change in hormones.
Yeah. All right. So there's several other symptoms I think I'm just going to like throw them out to you because I feel like I'm going to totally derail you if I start asking all my questions or talking just about my thoughts in general, that you can give me you're on the right track or not on the right track about medications and how to approach like the totality of these things for people who are HSPs going into perimenopause who are dealing with some of these things. So a couple other symptoms that, are pretty prominent: sleep changes.
Mhm.
How are people who are highly sensitive, what is their sleep need? Or are there differences? Like, what does that look like? Are they the people who are more likely to be startled awake, sleeping lighter, needing more sleep? Are they more like what is the HSP sleep situation?
I mean, we run
The
the
gamut,
whole
the
gamut.
whole thing.
Yeah, but it is a good opportunity to talk about the role of progesterone in sleep and how, as progesterone declines, we do see more disruption in sleep. And progesterone is specifically tied to, we talked about this last time, our stress response. And so sensitive people will oftentimes see a decrease in progesterone long before the typical perimenopausal range. They might think that sleep was an issue before perimenopause, but it might have still been hormonal. It might have still been related to a decreasing progesterone.
Mhm,
So typically, the sensitive person will have more sleep disruptions than a non-HSP, and that just makes sense because you're hearing things more easily. You're, maybe having more vivid dreams. You're more in tune with the fluctuations, the physiological fluctuations, which can be driven by blood sugar changes, which of course are also a big topic in perimenopause when the ovaries begin to decrease their own production of hormones, the other endocrine or hormone producing organs will start to have to compensate. And that means that the pancreas, or the organ that produces a lot of our blood sugar regulation, can just get tired and not be able to carry the load, the digestive transformation into fuel. It can start to backfire or become deficient in insulin production, or cortisol can spike blood sugar as well, or even cortisol spikes during the middle of the night can also cause us to wake up. So
mhm,
there's many hormone driven reasons why sleep becomes disrupted during perimenopause, and it's also common for sensitive people to have had experienced that prior to
mhm.
perimenopause as well. So progesterone is one of my favorite things to prescribe early on because it's for sensitive people because it is so soothing. It's a very calming hormone. Not everybody agrees. I felt very calm during my
Yeah.
pregnancy, and some women don't. Obviously, some women can have paradoxical reactions to progesterone. I have seen that in my practice where it actually causes a lot of mood disruptions for them. So it's not a blanket across the board, but most highly sensitive women will usually respond very positively to progesterone. As we're talking about depression, one, when your progesterone's too high, that can happen. We can feel like it can have a depressive effect. So even if your provider says, well, this is a really low dose, just remember that for you as a highly sensitive person, 50 milligrams might be too much, and you might need to have a compounded 25 milligrams. Whereas some women will go up as high as 200 milligrams, and depression can be one of those symptoms. Also, antidepressants, which are a very common prescription for women in perimenopause, which may be appropriate and may not be appropriate,
Mhm,
HSP or not. But as a highly sensitive person, one thing that is really painful for women on antidepressants, because obviously that can happen outside of perimenopause, is the dose being so high that they get to a place where they're completely numb. And
mhm,
although highly sensitive people will say it's so painful to be this highly sensitive, it's also really painful for us to not be in touch with that because it's such a central part of our identity.
mhm.
And if that experience occurs, it's really important to know that there are alternative ways to feel better without losing such a central part of who you are as a sensitive person.
Yeah. And since you already mentioned the progesterone, I would assume that people who are highly sensitive are more likely to need a lower dose, especially of psychiatric medications,
Mhm.
which is like kind of the reverse. Like some things you need more of, like you need more of the nutritional support, but that you're probably more likely to be reactive. And I say you, I'm still trying to figure out if I'm a highly sensitive person. You have told me I am. I'm still trying to figure out if I actually am. Though I read a book. I was one of the books that I'm reading this weekend said something. I was like, oh, crap. Is this it? Is this the foundational component of where people who are highly sensitive can shift? And it was like, I was a thinker, I'm not a feeler, so I'm not connected with my intuition. And I was like, oh, is that what it is? Is that like the shift? Anyway, probably an entirely different episode.
I'll
and I'm
get there.
derailing us. But so anybody who is back on track, anybody who is a highly sensitive person, perhaps me, and definitely you, is it that certain medications or certain things are that you need less than the average person versus others needing more? And I guess maybe it's just a trial and error, but psych meds are one of those that you're probably going to need pretty blanketly less than the average person. Am I right?
Yes, usually. And I love that you said trial and error because it's so important to find a provider that is going to really walk beside you through that journey because it's not typical. I mean, conventional medicine is a one size fits all mentality and paradigm. And providers who are willing to meet the individual with their needs are definitely happening more often. I'm coming across them
Hmm.
more frequently than I did before, and it's refreshing and wonderful. And if you don't come across that after your first, second, third provider, keep at it. They exist. Certainly a lot more in the functional world where you and I live, functional medicine world, but they do exist in the conventional world. And having somebody who is willing to listen to your specific response to any intervention, in that case, medication, but nutrients as well. But you're spot on about that. Sensitive people tend to do much better with higher concentrations, tend to. I see every possible response. And I think that's really the lesson and the message, especially going through perimenopause when there are so many variables, is listen to your body, learn to speak your body's language, and explore that with your provider because every intervention is going to be unique for you. And it becomes critical during perimenopause to have a really clear understanding of what are the interventions, how am I responding to them, and trying to keep them as straight as possible so that you can advocate for your own needs.
Yeah. Because as soon as I say more likely to need higher doses of nutrients, I'm like, unless they are somebody who has MTHFR variants and they're taking methylfolates or other methylated Bs, and then they probably need less. They're probably more sensitive to it. And so probably need more C, less B, more magnesium and sodium and potassium, maybe less iron. Like, and maybe I could be wrong on that. That iron could be, oh, am I right? You're nodding that maybe less iron. Or you just don't know? It's a
That
maybe.
specific mutation, MTHFR, I mean,
And not just MTHFR causing it, but like that I'm just thinking of like the nutrients that are more likely to be retained or have difficulty with clearance, that kind of thing. And so and the ways that we can have issues with clearance depending on both our genetics, but also just how our body is functioning overall too. Because it's not like we just have this soup that's always constantly being made of a certain level of hormones and certain level of neurotransmitters. We're responding to our environment. And so if your environment feels differently based off of where you're at on the sensitivity spectrum, you're going to be producing more of something that then you have to rely on your body's mechanisms to clear that thing and the detoxification that we were talking about earlier. And so it's just all really variable ultimately. And I was even thinking about something as like, if somebody were to, instead of using something like an SSRI, like a Prozac or Zoloft, that they might be using something like 5-HTP that they would hear about, or instead of using an SSRI for anxiety, they might be using theanine or something like that, that are proteins that are potentially going to drive things like if you take a higher dose as a highly sensitive person, you could be driving a biochemical pathway that is similar to what a medication is doing. And so you actually need a lower dose of those things too. We're getting super geeky today.
yeah.
Yeah.
And I've gone down those paths, and sometimes people are very data driven, and so we do genetic testing and we go
Hmm.
through and look at all the pathways. And because sensitive people have this really narrow optimal window of functioning, once you learn your body's language, it's actually really easy to understand which direction to go. And it doesn't have to get that complicated. Some people really like
Yeah.
it and can do that, but it is just about listening to your body and making adjustments according to how it responds to each different intervention.
Yeah. So you also have to be embodied and be able to listen to your body to be able to do that. And I'm sure that can be a challenge for many highly sensitive people, especially if they've had a history of trauma or disordered eating, that there is more disembodiment. And so that could be more challenging. And I bring this up because we've already touched on medications. I'm just going to throw this out there as well. There are things that outside of the functional medicine realm are not really talked about for like medications being recommended during perimenopause or at any time, that there are these medications that we use, especially psychiatric medications, cause nutrient depletions in our bodies. And so I'm just all the 10,000 places that my brain just went was, okay, how many people who are highly sensitive people are having really bad side effects from medications are just people who are disembodied and not recognizing that they're on too high of a dose.
That's a really important topic, actually, the embodiment piece.
Well, we've got the challenge with the embodiment about whether you might just not be actually connecting to something being too much, or whether it's too much or sometimes even potentially not enough of something, since it can go both ways. If you're an HSP and then you throw in the perimenopause where you've got so much chaos happening with all of the ways that the spider web of hormones are connected to each other and the dysregulation that occurs in your sex hormones, so the estrogen and progesterone and testosterone, and that are spiking at times they shouldn't be, that are like so overlapped and everything, and then tugging on that web and pulling all of the other hormones with it. And then on top of that, you've got the challenge of nutrient depletion that comes from medications too, in particular psychiatric medications, causing especially like B vitamin deficiencies for SSRIs. Those are a pretty big depletion that can come, which is interesting because it all like that can drive further depression and anxiety. And so it's this self-perpetuating cycle. And then you've got the ADHD medications if you throw on top of that. And so the ADHD medications that by their very nature, because of what they're essentially forcing your body to produce more of, so that you are getting the receptors that you need flooded with something to allow for more focus and attention and emotional regulation. It's also depleting magnesium in particular, but other electrolytes as well. And most of your nutrients can be depleted by the stimulant medications at the very least for ADHD. There's like this whole big mess of things between the embodiment and then the nutrient impacts and also the nutrient needs that are very different in an HSP, plus the spider web of hormones. So now that I vomited all of that out, Karen, tell me what is going on.
Makes sense. Yeah, it's complex. It's really complex. And that it puts us in a position where we need to pay extra special attention during a time when we don't have any time to pay extra special attention.
Mhm. Yeah.
So we're talking about learning your body's language and, deciphering if something is too much or not enough. And we have, I mean, if our listeners are anything like us, so many things that are happening at the same time, right? Like my ADHD diagnosis happened in midlife. And obviously my hormones were already doing the perimenopause dance. And then we are slammed with life being literally as busy as it ever has been and probably ever will be in this period of time. So, not that I have an answer, I'm just reflecting back how complicated it is, how many moving parts there are, and having as many forms of support through it all,
Mhm.
because that helps. One of my favorite things to do for women in and midlife is to say, you don't have to think about this once you leave. We can hold it here, because I know what it's like to want to move things along outside of a particular session, and then I enter my regular life, and I'm just bombarded with everything. So having different containers, different providers that can hold things for you, I think is one way that you can, okay, we're going to tend to it when I'm there and we'll pause it. I'll bring back as much data as I can, but at least we have that container to
Yeah.
help gain clarity.
I love that you bring that up because there's so many things that it just takes so much work to take care of an aging body. We haven't even touched on these things, and I'm going to like just throw them out really quickly in case you've got any insights that you really want to share. And then let's shift a little bit because yes, you're a naturopathic doctor and you're amazing and you're able to make sense of all of these things that even me as a naturopathic doctor, like I understand all of these things enough to obviously like vomit it all out and just be like, and now what? And this is why I personally, I feel like maybe it's just how my brain functions, but I'm like, if I'm going to handle something really complex, which I do, the condition that I work with in my practice is very complex. I was overwhelmed by it until I said, I'm just going to do this. And I almost feel like, especially like anything related to being an HSP, I feel like you can't just go see somebody in general because like there's so much that you have to think about and so much curiosity that you have to have an understanding about the experience and like what's happening in the body and all of the things that can contribute to it. Anyway, so I'm going to throw out all these other things. Tell me what you want to say, but then we also need to talk about some of the stuff that you can offer from your therapist perspective too, and just like your human going through all of this together perspective as well. So I don't want to shortchange you or anybody, me included, from getting that perspective. So the other things, like skin changes that can come up in perimenopause from between, being in what is it? Cougar puberty. Is that what we call it now? Cougar puberty. That so you can have all of a sudden like all the acne and stuff coming back, plus the dryness, plus the like all the redness that, that's my favorite thing of perimenopause is all the like blood vessels that are not cooperating anymore and making me look like I'm always just a little bit sunburned. And that's a sensitive thing. Don't ask me if I've had sun if you see me in person. Don't, oh, have you been in the sun? Don't ask me that. And so we have the skin changes. We have changes in sex drive, in experience of sex and orgasms. We have changes in just sexual function and overall joint pain, stamina changes to our hair. We've already talked about changes to our bowel function. Any of these things that you want to just add in a little bit of stuff that people might need to know that's different for somebody who's an HSP.
Yeah. Well, I'm going to jump on the joint changes. I mean, obviously, we could talk about any one of those for an extended period of time. I'm going to jump on that one first because it's a lot. Well, a lot of the things that you said actually are not at the top of people's minds when they think of perimenopause. So I'm really glad that you went through that list because, yes, all of those things happen during perimenopause and beyond as we're learning, as more research is being released finally. The joint pain stands out to me because what I learned is that testosterone is the first hormone to start to drop. And I know I mentioned progesterone for sensitive people, and that is true for sensitive people, that progesterone happens usually before testosterone. But in terms of the typical trajectory of perimenopause, it's actually testosterone first. And I'm talking, you mentioned joint pain, and joint pain is actually one of the first symptoms, or musculoskeletal discomfort is one of the first symptoms that can pop up when testosterone starts to drop. And I think it's so easy for us to say, oh, well, I'm just getting older or what have you. It can be as simple as either hormone replacement therapy, or of course, there are herbs that can help to support the production of testosterone in our bodies. And I wanted to highlight that because I struggled with it for way longer than I should have because I didn't even know that. And I'd like to mention that we went through not just a medical program, but a program that really focused on the physiological, biochemical aspect of health in a way that is different than conventional medicine. And we did get a decent amount of hormone information in our education. And yet, I don't remember learning that. Did you?
Mm-hmm. No.
No. So that's unfortunate. But the good news is we're getting more of this information. And I happened to read a study about the effects of testosterone in early perimenopause for women. And I thought, oh my gosh, it's my joints. I just thought, that they were just getting older. And I noticed that I wasn't bouncing back from my workouts the way that I used to.
Mm-hmm.
And I felt like I just didn't have that, that gumption to go have a really good workout. And part of that was also shifting the type of workout that I was doing. But I will say that I see this over and over and over in my practice that testosterone, either through herbs or through hormone replacement therapy, can have a really positive impact on those symptoms specifically. So I wanted to highlight that because it's not a common
Mm-hmm.
conversation with an OBGYN. Gynecologists don't typically talk about that. That's worth a mention. Skin and some of the other things, not always, but detox again, right? When things can't get through the liver, they can't get out through stool or urine, they'll come out through secondary organs of elimination, which can be the skin. So when you have all these fluctuations and we're not detoxing appropriately, that's not every single thing that you mentioned, but it's a simple thing to do. So increasing hydration and supporting regular bowel movements just to make sure that you're flushing things out effectively and consuming enough binders, so fiber, to help grab
Yeah.
it, get it out.
I got two more things that on like the geeky medical side that I think are worth at least mentioning or you giving me your feedback on. So the first one is that I think the biggest takeaway when it comes to medications, nutrients, any type of treatment for symptoms is to recognize that in perimenopause, everything is connected. It's all that spider web. And when you're an HSP, it's even more delicate with the nudges. And so a small nudge might feel like nothing if you are someone who is an HSP, if that's something that it's being pulled very hard in another direction versus if there's not really a big pull happening or it's just like a general tension on the web and you add something else in, it can feel like too much with even a small amount. And so, because all of these things are really connected to each other so much that really looking at the totality of what you're experiencing is vital to ensure that you're not overdoing it in one place or underdoing it in another place, or that you're misinterpreting the experience of something that could actually end up being really supportive for you as being a problem when it's really just, no, it's taking something else that needs just a little bit of additional support in order to make this thing be as effective as it really could be to give me the relief that I need.
Yes.
Yeah.
Beautifully stated. Yes. And just this morning, I had an appointment with somebody who had been on ADHD medication and they were feeling way off from themselves. And they thought, oh, maybe it's the medication. We just had to add magnesium because it was becoming so depleted for them that it was creating tension and it was negating the positive effects of the medication. So they ended up coming down on the strength of the ADHD medication and adding magnesium, and they felt like a whole new person. So yes, it's not one or another. It can be just shifting each little thing slightly, and it can be perfect for them.
Right. So it could be that actually reducing something might be beneficial rather than increasing something if it no longer is feeling effective because of all of these interplays that come about from everything. All right. My other thing that I really want feedback from you on, because I'm not sure, and maybe you don't know the answer to this either. I'm curious, since there are shifts that you're saying that people who are HSPs can feel earlier in like like technically prior to perimenopause, it made me wonder if there are changes that people will see in hormone panels that are different in perimenopause. So will some of these things show up on labs? And furthermore, are any of these other nutrient changes or nutrient differences, are they likely to show up on labs, or is this something that your doctor might tell you everything is fine when that's not really the case?
Yeah. Yeah. I mean, I was thinking specialty labs, conventional labs, 100% you're gonna feel it before anything is visible on a conventional lab. For example, gynecologists will track FSH to determine if you are in menopause, and they don't consider anything with FSH until it's above 30, and we're looking at it when it's approaching 10. So it's not that the labs aren't showing it, it's the way that they're being interpreted. But
Mhm.
even then, conventional labs just don't have that sensitivity that specialty labs can have. So it is really common to have that conversation, unfortunately, where it's, well, I hear that you're not feeling great, but your labs still aren't at a point where the gold standard would be to take action. They could, but it's very important for conventional providers to stick to the gold standard because that is what insurance covers and that is where they're told they need to be. But that doesn't mean that things can't be done. And it doesn't mean that there aren't labs that either the same labs that can be interpreted differently or specialty labs that can really highlight specifically where the intervention would be most appropriate.
Yeah. I am feeling like we have this dives into the other part that we want to talk about. And I'm also recognizing we're about at an hour, and I don't want to overwhelm anybody with stuff since we just like got super geeky on all these things. So I'm wondering if we should have one more, maybe shorter conversation that's about the therapist stuff and the experience, like the lived experience stuff that would be beneficial so that we don't overwhelm ourselves or our listeners with even more things.
As
Sound good?
it felt like a whirlwind. It's so much. It's so much. And maybe,
And but I mean, isn't that the kind of the point? It is a whirlwind and there are 10,000 things to consider. I know that because of where I'm at in my life and the medications that I'm on, and I mean, my hormones are a little bit different with perimenopause because of the endometriosis and all of the medications that I'm using to manage that. But it's a good reminder that I do need to make sure I'm taking my minerals every day, that I probably need to increase my magnesium at night. And that might be part of what's going on with my sleep that's not where it should be. And that I can't suddenly understand why it's changed. So I think that even if there's not like, do this, then this, then this, that's the point. You can't do that in perimenopause, nor can you do it with an HSP. And so you sure as heck can't do it with somebody who is an HSP going through perimenopause. And that there are a lot of people who are suffering unnecessarily because they're not putting these pieces together appropriately. And so, yes, a chaotic whirlwind of all of the things and the geeky brain dumps and, ventures into all the different things that come up that just jumped into our brains. And I feel smarter from having had this conversation with you. I feel like I understand it a bit better than I did before we started talking. So I appreciate it.
yeah, I always really appreciate having these conversations on topics that are complicated and charged. And I always feel better at the end of our conversations. And I hope that our listeners have found benefit. And if they have questions, I hope that they communicate them to us. So if you're out there and you're thinking, oh my gosh, I would really have loved to have heard more about a specific topic or gain clarity on something, maybe that we could go deeper into, please let us know. And we'll
For sure.
absolutely incorporate that.
Absolutely. Because we want to make sure that we recognize, right? We've got blind spots because we're naturopathic doctors. So we just both like jumped to things that we've had training in. And it would have been way worse if Eliza was here. So thank goodness that she wasn't here to add to all of these things, though
Yeah.
perhaps she would have,
Maybe she would have grounded us a little bit more.
who knows?
She does
We'll
do
find
that.
out because the thing is, we've got lots more opportunities. We're going to talk about stuff that's beyond just HSPs as well and have a little bit more in depth about that. So for anybody who's not an HSP, don't worry, that's coming, where we're going to talk more about the details and with everything that's happening and share from our personal and professional experiences about that type of thing too. So stay tuned. We'll be back with that. And we'll be back with a little bit more on the personal lived experience and therapies, relationships, exploration of self as an HSP going through perimenopause. All right. Until then, love you, Karen. Thank you so much.
Love you.
All right. Bye, guys.
If our messy is your kind of messy, we'd love for you to rate, review, and follow or subscribe wherever you get your podcasts.
We'd also love to know what's on your mind. If you were to join us, what would we be talking about? Email us at messymidlifepodcast@gmail.com or message us on Instagram or TikTok.